Well, February is American Heart Month, and one of the subjects that always seems to come up is high cholesterol. And Dr. Mitchell St. Clair, a cardiologist with Novant Health Cardiology, is here to share some of the latest information. Thank you so much for joining us today. We do appreciate it. All right, let's start with this high cholesterol. Why is that considered such an important risk factor?
So cholesterol is one of the major modifiable risk factors for the disease of atherosclerosis, which is basically blockage of the arteries that lead to your brain and to your heart. And we can use medications like statins to help prevent those blockages or treat those blockages.
Well, how do you determine when someone should be taking these statins?
Well, we determine it on an individual basis. If patients have had a heart attack or a stroke, they automatically have an indication to be on a statin. If they haven't and we're trying to prevent heart attacks or strokes, we utilize various risk scores to calculate how at risk someone is for a heart attack or a stroke. When they reach a certain threshold, we know that the benefits outweigh the risks of a statin.
So what about those side effects?
Sure, they're well publicized. Statins do have side effects. In general, they are safe. Less than 1% of patients that, experience a serious side effects. Most people can have some myalgias or muscle aches, but there are 7 statins on the market now, and we can usually tweak the agent or the regimen to get something that's well tolerated from the patient.
Well, what about for people who want to deal with it through lifestyle changes?
Yes, I'm a big proponent of living a healthy lifestyle. So eating a healthy diet, keeping an eye on the blood pressure, keeping an eye on your cholesterol levels, and most importantly, being physically fit. I recommend 30 to 40 minutes of exercise 5 to 6 days a week. Those are pretty hard things to sustain over time. So even if you are doing that and you still have an elevated risk, we'd want to put you on a statin to help decrease that risk.
Sounds like you're following some of your own advice looking at, is there a possibility of any new cholesterol medicines with fewer side effects?
Sure, there are some things on the horizons. Probably the most promising drugs are actually injectable drugs, PCSK9 inhibitors. They're being regulated by the FDA right now, and it looks like they are going to be out hopefully in the next couple years, and they seem to be much better tolerated with less side effects.
All right, going to have to make that the last word, but thank you so much. We do appreciate your being here.